Hey everybody, it's Dr. Cole. It's estimated that over 27 million Americans are going through some sort of low thyroid problem, whether it be weight loss resistance, fatigue, brain fog, irritability, depression, hair loss, hair falling out, hair thinning out. It could be brittle nails. The devastating symptoms are so great and are affecting so many Americans. And it's estimated that it's the number one most undiagnosed endocrine problem in the world. And what does the mainstream medical care offer? It is the same with any chronic issue. It's to diagnose the disease and matching it with the corresponding drug. And in this case, it's levothyroxine, it's Synthroid, or some sort of thyroid hormone replacement drug. And it's based normally on, the mainstream tests are based on thyroid stimulating hormone, or TSH, and it's based maybe on T4. That's the extent of labs that are run for people that are dealing with these low thyroid symptoms. And they're told to just take this drug, go home, see you in 3 months. And so how can you have all of these symptoms but yet have normal TSH? Because TSH is just one aspect, one piece of the puzzle of this whole myriad of complex issues when it comes to the thyroid. And beyond just the labs that are run, we have to look at the interpretation of the labs. When you get a blood lab done for your thyroid or any other issue, on the right side of your lab you have that normal interval range of what's considered normal. Well, how we come up with those normals of normal intervals is a statistical average of the population of that lab. Who are the people that are typically going to labs? There are people that are sick. There are people that have symptoms that are trying to find out why the heck they feel the way they feel. So when your doctor says you're normal, what they mean is you're just like a lot of other sick people. When your doctor says you're normal, go home and live with it, it's in your head and gives you an antidepressant because they just think you're depressed. What they're really saying is, just like a lot of other people that have symptoms, you're just like them. We need those interval ranges. We need them because we know if you're outside of those, there's something really wrong. But you're not healthy one minute, then sick the next. Those numbers are not just magical demarcations of when you automatically get sick. You're trending towards disease, or you're trending towards health. You're trending towards optimal function. So in functional medicine, we have to look at a much narrower range of what's normal. Where is the body functioning at maximum capacity? And that is a much narrower, thinner range than the normal huge interval range that the labs are looking at. So we have to look at the gray areas where people are having symptoms that are struggling with weight loss resistance, struggling with depression or fatigue, or all of these low thyroid symptoms. They're having these symptoms, but they're told they're normal. So we have to look at the interpretation of the lab, which is done completely different in functional medicine, but we also have to look at the labs that are run. So most of the problems with low thyroid are not going to show up in your standard test that your PCP or your endocrinologist run, because all they're concerned with is giving you the appropriate medication, and that's the extent of their training. It's pharmacology. So when your training is to diagnose the disease and match it with the corresponding drug, those tests are sufficient enough. You can just run a TSH, you can run a T4, and you can give Synthroid out, and that's just the course of action. But when you want to look at the underlying reasons of why you're feeling the way you feel, it just is not enough. It's insufficient, it's inadequate, and we have to look a little bit beyond just the label of the disease, because we're doing more than just giving a medication for a disease. We're actually dealing with underlying immune issues. We're dealing with underlying metabolic dysfunctions that can be reversed and can be, your health can be restored, and you can feel like yourself again naturally when you deal with these underlying issues. So I want to go over the 6 main patterns with low thyroid function that do not show up on your standard thyroid test. The number one thyroid pattern that I see in my patients is autoimmune thyroiditis, or Hashimoto's disease. And research correlates this as well, that we see over 80% of people that are struggling with low thyroid symptoms have autoimmune thyroiditis, or Hashimoto's disease. Why are the tests that diagnose Hashimoto's, why aren't they being run by and large? It's because the same course of action will be given. The levothyroxine, the thyroid replacement drug, will be given to everybody no matter what the underlying cause of your thyroid symptoms is. But it means the world to run the test for people that want to actually find out why they feel the way they feel, and then to have a program tailored to their physiology, which is not a one-size-fits-all. Everybody is created, everybody has their own variability that we need to take into consideration. So we have to run the proper antibodies to see if you truly do have an autoimmune disease, because the treatment plan will be completely different. Because with these cases, they don't actually have a thyroid problem. Their thyroid is victim to their immune system. So until you deal with the immunology, you're always going to be having these symptoms. You're always going to be struggling with what you're struggling with. So we have to go through and run the proper test to see if you do have Hashimoto's or an autoimmune disease attacking your thyroid. The next thyroid pattern that I see in my clinic, but that won't show up on a standard thyroid test, is hypothyroidism secondary to pituitary hypofunction, which just means your pituitary gland, a gland in your brain, is not communicating with your thyroid properly. So there could be nothing wrong with your thyroid, and because it's not being told what to do. The pituitary gland is supposed to tell the thyroid what to do. So until you deal with the upstream problem, which is the pituitary hypofunction, the pituitary not working like it should be, you're always going to be struggling with these issues. But this dysfunction, this pattern, is not showing up in the standard model of care's test. So we have to look beyond that label and run the proper test to see if the pituitary gland is not functioning properly. The next thyroid pattern that I see in my clinic are patients that are having an underconversion of T4 to T3. T4, or the inactive form of the thyroid hormone, needs to be converted to T3, which is the metabolically active form of the thyroid hormone, to be usable in your body. But a lot of patients have what's called low T3, or this underconversion of the thyroid hormone. But again, they're showing up, their TSHs are normal and they still have these symptoms, but the reason is their body's not converting T4 to T3. And the conversion of the thyroid hormone mainly happens in the liver, it happens in the gut. So we have to look at the other systems in the body to see why isn't the conversion happening between T4 and T3. And then obviously we have to look at T3, we have to look at reverse T3, we have to look at these different biomarkers that are not being run typically in the mainstream medical care. So again, this is another major dysfunction that I see in my patients, but again, it's not being looked at in the mainstream care. The next thyroid pattern that I see a lot that is widely undiagnosed is a thyroid overconversion and a decreased thyroid binding globulin, which are the protein carriers that carry your thyroid hormone throughout the body. What this overconversion does, if it's too much of T4 is being converted to T3, you'd think there wouldn't be a problem. There's a lot of metabolically active T3 just roaming around the body. But the problem is it overwhelms the cells and actually causes a resistance pattern. This is seen a lot with PCOS, polycystic ovarian syndrome. It's seen a lot with insulin resistance patterns, type 2 diabetics, because these excess testosterone levels in the body, especially in women, can really cause this overconversion of T4 to T3, and it overwhelms the cells. So we want to look at, again, beyond just the TSH, beyond just the superficial labs, to find if this very common dysfunction, this very common pattern is your case. Another pattern I see a lot of times with people with low thyroid symptoms is a thyroid binding globulin excess, an excess of TPGs. So these protein globulins are protein carriers for the thyroid hormones. Hormones need a protein carrier to be used out throughout the body, but when they're bound to these protein carriers, they're metabolically inactive. They're not being used. They're basically being used for transport. A lot of people have excess TPGs, or these protein globulins. So what's going on here is that you have a lot of inactive thyroid hormones that they're not being used metabolically, and this is seen a lot of times with excess estrogen. So we have to look at the underlying female hormone patterns and to get a better understanding of why you're going through what you're going through. So people that are on birth controls, people that have excess estrogen, people have estrogen hormone imbalances, they could be having this thyroid dysfunction that's not showing up in a mainstream medical lab. Another common thyroid pattern that I see a lot in people is a thyroid resistance pattern that's similar to insulin resistance with type 2 diabetes, where the cell membrane is inflamed, the receptor sites are blunted, and it's causing a resistance pattern on the cell membrane. So the thyroid hormone is being produced normally, but it's not getting onto the cell. So you have this resistance pattern that's going on throughout the body, but again, it's not being looked at in the standard model of care. So you have to look at inflammatory biomarkers, you have to look at homocysteine levels, you may want to look at reverse T3, things that can cause this resistance pattern in the body. Another good biomarker is C-reactive protein. These all have to be looked at to get a real comprehensive understanding of why people are going through what they're going through. So if you're struggling with these symptoms, low thyroid symptoms, but are not getting answers in the standard model of care, if you're told you're normal, to just live with it, your labs are normal, even though you're struggling with what you're struggling with, I consult people all across the country via Skype consultations, phone consultations, as well as locally in Pittsburgh, Pennsylvania, to enable us to clinically investigate these underlying issues of why you're going through what you're going through. So you can check out drwillcole.com for more information.